This is a pattern on a patient and a very nice post-adjustment clear. This patient presented with fibromyalgia and chronic fatigue syndrome. The patient had been treated with physical therapy, medication, exercise, chiropractic, and acupuncture with limited success over the past 35 years. At the beginning of care, she had been unable to work for the past 10 and described her daily life as filled with pain and a complete lack of energy. Within 3 months, the patient had returned to full-time work and was free from pain. At over 1 year follow-up, the patient's condition had only continued to improve with the addition of daily exercise. That, my friends, is the difference between a subluxation pattern and a clear pattern. The difference between the sympathetic nervous system being hyperstimulated and the sympathetic nervous system being returned to a normal level of activity. Not all graphs are as clear as being totally in pattern or being perfectly clear. As I said, clearing a graph, quieting the sympathetics, does require a correct adjustment, the correct listing in the correct place at the correct time. Sometimes a patient will present, and we will call this an adaptive scan. Here's their pattern. Here's their present graph. It's not perfectly straight, but it's within 1/2 degree centigrade. It is nowhere close to being the shape of their pattern. Presenting like this, we would not adjust that patient. Another example of an adaptive graph. Again, the dark line being, this line being the pattern, the dark line being the graph as they presented for this office visit. Again, not pattern. Actual crossing here on the actual temperatures. That's why it's so nice to see these as well. This patient is not in pattern. This is an adaptive scan. An adjustment would not be called for. Another example of an adaptive scan, not pattern, within our 1/2 degree window and different from the previous days. These both are not adjusting graphs. This is one more example of a patient presenting to an office visit with a clear to adaptive scan. Again, look for every excuse, especially upper cervically, not. One more example of an adaptive scan. Now, sometimes a patient will appear with graphs that are beyond that 1/2 degree swing, but they're not patterned. When we look at the DTs, we tend to think, well, they're awfully close. But again, it's the differential that most of the literature is published about, and you'll see that it is not the same graph. But it is outside that 1/2 degree window. It is a point of concern. You'd want to see this patient more often. Again, a graph that is not similar. It's outside the 1/2 degree window, but it's also not patterned. One patient presented to the office with a very wild and drastic graph, had fallen and bumped her head on a dishwasher, was very much in pain, wanted to be adjusted, but the graph was not her pattern. The doctor re-x-rayed that patient, marked those x-rays. In the morning when she came in, the night that she came in, she was not in pattern. The following morning when she came in, the doctor graphed her again. It was the same graph as the night before. Very large temperature swings, the exact same shape, all 3 graphs, but not her pattern. At that point, he re-x-rayed the patient and found that her listing had perhaps changed. He adjusted her according to that new listing and cleared the graph. So it is possible for trauma in a person's life to cause a change in their pattern. It's not very frequent, but it does happen. My pattern graphs have remained very similar ever since I started being scanned about 12 years ago. This was just another example of why the original NCM missed sometimes interpreted when someone was in pattern. Again, these two graphs look very similar, but when we actually look using the Titone C3000 at the actual skin temperature that led to this shape, we see that it was a very different set of temperatures on the body that just happened to create the same shape. This patient is not in pattern. We would not adjust. We get about one call a month where a doctor will call in and say, I think my instrument is broken. The lower part of the back, this is a full spine graph on a patient, the lower part of the back is very, very cold. We start measuring and graphing at 30 degrees centigrade. This patient was just extremely cold, probably a very long-term subluxation, and it wasn't until we reached about the middle of the back that his skin was warm enough to actually start recording pattern. The doctor adjusted the patient, and sure enough, the next day, this whole area had warmed up. His listing was accurate enough that it did affect and quiet down the sympathetics. If you go to our website, I encourage you to do this, Titronics.com, you will see two case studies that were done and reported in today's Chiropractic by Dr. Bill Amalu, who is also our research consultant. He followed these cases using the C3000 as he does all the patients in his office, and these were somewhat remarkable cases in that the 5-year-old boy, who I'm going to just briefly go over his office visits and when adjusted, presented with cortical blindness, cerebral palsy, epilepsy, and very, very bad ear infections that were repeating and repeating. That's why he was brought to the office. This graph represents his pattern. So for the first 2 or 3 office visits, all that was done was that the child was graphed, looking for his pattern before he was adjusted. Then x-rays were taken, a listing was established, an atlas listing at first. The child was adjusted. I'm going to go over just very briefly, and again, this is in great detail on our website, the follow-up weeks. Week 1, first adjustment. Right after that, the child had a good night of sleep, and atlas listing was considered. Now, remember, when you see our website and read the story on this child, at 5 years old, ever since he was 6 months old from wellness shots, this child has been going through seizures, grand malls, diagnosed cortically blind, was deaf, could not talk, could not walk, was literally a bundle of human being with no input or output. First adjustment, atlas. First good night of sleep reported by the parents. Second adjustment, and this is during the first week, seizures dropped to 10 a day from 25. He started clapping his hands. The moaning that he was going through constantly was reduced. That was only 2 adjustments in week 1. Week 2, 1 adjustment. The child was by then more alert, sitting up, appearing to be looking around, sleeping more soundly, responded to sound. Seizures dropped to 5 a day, responded to bright light stimulus. Now remember, this was one that was diagnosed cortically blind. Writhing motions were ceased, and his ears cleared of effusion. 1 adjustment. Week 3 and 4. In 2-week period, he was only adjusted 3 times. Less than 5 seizures a day, all grand mal ceased, vocalized data. The therapist noticed that vision was improving dramatically. He mimicked answering the telephone, and fine motor skills were returning.